Thank you for choosing Xray2Go as your X-ray solution. The purpose of this video is to teach you how to operate Xray2Go and to show you the techniques that will ensure the safe use of Xray2Go. The successful completion of this training is required before using Xray2Go in some jurisdictions. As part of this training, study the manual in its entirety before operating Xray2Go. There's a soft copy of the manual on the included DVD. As the operator, it is your responsibility to ensure the proper and safe use of the Xray2Go. After completing the training, we strongly encourage you to take the Learning Reinforcement exam included in the user manual. Please note that this training material is not intended to replace basic radiation training. This training is presented under the assumption that operators already have basic radiation safety training. You must also be aware of any local jurisdiction requirements for training and the use of the Xray2Go. Now let's get started. Anytime you see this symbol, it's an indication there is an associated hands-on exercise. Let's take a look at the major components of Xray2Go. First, on the top of the unit is the power button, on or off. Second, a display screen. Third, control buttons, up, down arrows, and select. Fourth, an X-ray exposure indicating lamp. Fifth, an X-ray collimator cone. Sixth, the backscatter shield. Seventh, the X-ray exposure button. And eighth, the hand strap. On the left side of the unit, there is a backup port, a milliamp measuring port, a hand switch connection port, and a battery charger connection port. On the bottom of the unit is a mounting screw for an optional arm, tripod, or pistol grip. There are also two screws which allow you to remove the battery cover if you need to access the internal battery. Please see the user's manual for more instructions. Now let's take a closer look at the control panel and display on top of the unit. First, there's the power on and off buttons. Second, the patient size indicator, adult or child. Third, the ready status indicator. Fourth, the kilovolt type display. Fifth, the battery charge indicator. Sixth, the mode select button. Seventh, the up and down exposure time control buttons. Eighth, the exposure time or error display. Ninth, the tooth type display. Before using Xray2Go, you will need to charge the battery. First, connect the charger jack to the side port. Second, connect the charger to a 110 to 120 volt outlet. While charging, the lamp on the charger will be red in color. When charging is complete in 2 to 3 hours, the lamp on the charger will change from red to green. Note, the system will not emit X-rays while connected to the charger. Now let's examine the various radiography settings. First, power on Xray2Go. After a moment, the display will indicate the patient size, the ready state, the battery charge is full, a single bar is for digital sensor use, the current exposure time, and the tooth type. To change the tooth type setting, press and hold the S button for 2 seconds. The current selected tooth type will flicker in the window. Each press of the S button will choose the next tooth type to the right. Notice how the corresponding exposure times vary. You can change the exposure time for the current tooth type by pressing the up and down arrows. To exit setup and save the exposure time for this tooth type, press and hold the S button for 2 seconds. A 3-second timer will count down and return to ready mode. To change the patient size from adult to child, press and hold the S button for 2 seconds. Then press the power off button once. The current patient size will flicker. Press the S button to select child or adult. You can change the exposure time for each patient size and tooth type by pressing the up or down arrows. To exit setup, press and hold the S button for 2 seconds. Countdown timer will go from 3 seconds down and return to ready state. To change the image receptor type from sensor to PSP to film, press and hold the S button for 2 seconds. Press the power off button twice. To the right, you'll see a number of bars. 1 bar indicates digital sensor. To change, press the S button. 2 bars is for PSP. Notice how the exposure time also changed to the corresponding receptor type. 3 bars indicates conventional film use with a much higher exposure time. You may change the exposure time for the current selected receptor type using the up and down arrows. When finished, press and hold the S button for 2 seconds. A 3-second timer will count down, then return to ready state. The factory settings of the Xray2Go are intended as a starting point. The time settings can be adjusted and saved to meet your preferences. In deciding on the appropriate time settings, remember the ALARA principle, or as low as reasonably achievable. This means to set the exposure time as low as possible while still achieving an appropriate diagnostic exposure. There are several factors to consider when choosing an exposure time. Consider the image density preference, clinical quality preference, the various imaging sensors and film speeds available, patient size and practitioner techniques. Power on the Xray2Go now. Adjust the technique factor time settings as demonstrated previously. To review correct positioning, we require the end of the collimator to be close to the patient and the backscatter shield parallel to the operator's body. Common positioning errors may include aiming the collimator up, exposing the operator's head, aiming the collimator down, exposing the operator's lower body, removing the collimator backscatter shield, which exposes the operator's head and lower body, or holding the collimator too far back from the patient. This reduces the amount of radiation received by the dental X-ray sensor. Now let's examine another safety feature of the system. Xray2Go Mini has a 2-step exposure button with a safety that unlocks for 5 seconds, then automatically relocks. To unlock the safety, press and release the button. The light goes white. You have 5 seconds to take an X-ray before the safety locks and the light goes green again. When locked, the light is green. To unlock the safety, press and release the button. The light goes white. To take an X-ray, press the button again and hold it. The light goes red and the system beeps during exposure. After 5 seconds of idle time, the safety will lock again and the light is green, indicating the system is ready and safe. In summary, remember to follow these important guidelines. Only trained operators should be allowed to use Xray2Go. Review the Xray2Go user manual. It provides a brief overview of all of the training and can be used as a reference in your office. Follow all safety recommendations. Stay in the safe protection zone for maximum protection. Sight through the backscatter shield, not over or around it, to keep yourself in the protection zone. If you're not able to stay in the protection zone, wear protective clothing. Secure the Xray2Go when not in use in its locked case. Follow all rules for radiation safety in your local jurisdiction. If you've not yet registered your Xray2Go with the appropriate agency, please do so now. As a reminder, we encourage you to take the operator training tests included in the user manual. Please study the materials and take the exam as many times as you need to answer all the questions correctly and to ensure complete understanding. Once you have successfully completed the exam, you can print the training certificate. Have it signed by your exam supervisor and keep it on file along with your exam. This concludes this video on Xray2Go operator training.